Well, thanks for being game.
Of course.
Yeah. You've walked into a buzzsaw.
I hope not.
Yeah, no, seriously. Did wound care in nursing homes when I came down here to Florida. And then I have switched over to chronic pain management in the nursing homes. And I have a very good friend that I've been in conversation with a lot about burnout, the state of affairs in medicine, healthcare. And I've also developed a kind of a different perspective moving into the functional medicine world. So I'm fascinated to talk with you as a health care administrator.
Sure,
is that a
likewise.
fair, appropriate?
Yeah.
Because, yeah.
It is.
I know you did more than that than just being an administrator at the nursing home. But
Right.
So let me just start with this. For many years, and having been on the inside of healthcare, I believe it's in crisis. I don't think that's surprising.
Yeah.
My friend, he's an educator, medical students. He's actually head of an ethics center at a big university out on the West Coast. And just talking with him last night, he said healthcare is in crisis and medical education is in crisis.
Okay.
And I have said to him, one of my frustrations is, and I lived through the development of DRGs and all that back in the late 80s. I was in school coming into residency, and then in the 90s and so on. So I saw those things change. And it seems that we have this edifice that has been teetering for a long time. And so one question is, what is the fundamental problem? But two, we keep tinkering with it, trying to make it better or fix it. And my thought is, I don't want to say we need to go tear it down, but I think the foundations are problematic for a lot of reasons, and that just trying to build on a shaky foundation is never going to work. So I'll stop there. What are your thoughts?
I 100% agree. Like I mentioned just before we jumped on here, is that the reason I left and sold the company was because the way the administrative side of medicine has zero to do with taking care of patients.
Okay.
And, it's all about, all right, you saw them, now get a follow-up. And so many of the patients you see can barely afford health insurance and co-pays or just cash visits. And then you prescribe medicines, and then they have to make a choice. Do I pay for this medicine or do I pay for my follow-up? And, it's just so based on getting them back. It's about volume.
I'm glad to hear you say that. I mean, it's intriguing.
The other side of it was what they were trying to do with Medicare and managed care and all that stuff, was to make it more about quality, which I don't know if we want to get deep into managed care, but that side of it is effective. And I think part of why the system became so broken is that we tried to incorporate this perfect blend of government and the private sector.
Okay.
By combining private companies who are more efficient but profit driven versus the government who's inefficient and doesn't care where the money goes. And so the idea was to let's do a blend of both so it can be more efficient, but then we got the best and worst of both worlds and that are competing against each other.
Interesting.
That's
Tearing
my
each
take
other
on it.
apart.
Yes.
And in the crossfire are the practitioners
And the
physicians.
patients. Yeah, everybody.
And everybody.
If
but
you're not
what
a
I'm-
large business or the government, you're not benefiting.
And so that created space for the hospitals to come in and
Yes.
become ginormous.
Yes. And that's why small practices are, endangered. It's difficult. You can't, as a small business, it's so difficult. Like most companies, you provide a product or a service and you get paid for it.
Right.
In the healthcare world, you have to get all these contracts, which means you need an attorney to go through all these contracts. There's a contract for every company and for every government, Medicaid, Medicare. And then you need billing.
Right.
That's extremely expensive and super complicated. So even if you do it in-house and hire a competent biller, it changes so fast and there's so many facets to it, they're not going to be perfect at it. And there's going to be
And
losses.
that's your lifeblood.
That's it. And me as an administrator, I'm not an expert in billing. So it makes it even harder to supervise it and do the checks and balances on it.
Right, which means then you need another level. A friend of mine this was back in the 2000s. Anyway, he was managing a cardiology group. And he said, John, healthcare billing is the most complex financial situation in the world.
Yes.
What we have. So,
and my practice did primary care in a clinic, and then we did assisted living, and we also did SNF. So there's 3 separate aspects in one small business,
right,
which made it even more
how
complicated.
did you manage that?
That's why I'm not there. We tried to grow it fast and get out.
Wow. Yeah. So in the crossfire, one concern that I've had has been burnout, and been talking about that a lot lately, the impact that it's having. And then I mentioned stepping out into the functional medicine world. I think we're seeing a paradigm shift. I don't know where it's going to go, but patients are clamoring for more personalized health care. They want, well, it's interesting what people want. They want convenience.
That's the other side of it. This is a product or service that nobody actually wants. It's not something that,
right.
So making people happy when they have to pay for something they don't want to pay for in the beginning and they don't even want is even harder. So it's hard to satisfy anybody in the business. It's tough.
I hadn't thought of that.
Yeah.
I hadn't thought of it that way, because I have patients coming to me in need. They're sick. They don't have answers. And of course, there's Dr. Google and now AI and chatbots and all of that. So the question is, where does the physician fit in? Can we change the paradigm? I started off saying there's a paradigm shift. I do think people want something different. We don't know where it's going to come out. AI is here to stay.
That's, I think, the main factor in how things are going to evolve from here.
And I think that can be used as a tool, and it needs to be learned about and appropriated correctly in the medical world. But I think I think at the core is the doctor-patient relationship, a very human relationship, someone who's in need, vulnerable, and someone who can provide help. So that's where my hope is, that because we have that at the heart, that will help drive things.
I think that helps tremendously, and I think there will always be a particular demographic that leans that way. Mm-hmm. And I think that's going to be mostly for people with chronic issues that have to go all the time and they want a relationship. But for people who just have a sinus infection, for all the acute stuff, that's going to be all AI.
Yeah, I think acute little stuff.
Yeah.
Yeah, and it depends on regulations. Are we going to let antibiotics be available and things like that? Or make it so that the physician can appropriately prescribe and whatnot.
Or maybe just the robot.
Well,
they could get to that point where they could just prescribe itself.
Right. And
stuff like that
may be okay.
Right.
But you make a good point. You mentioned people with chronic illness. There's a study out of Johns Hopkins where they concluded 93% of the population has some evidence of underlying metabolic problem. That's terrifying to me.
Say that one more time.
93% of the population have at least some element of an underlying metabolic problem. High blood pressure, overweight. Certainly that knocks off a huge percentage right there.
Right.
We're a sick population, and our acute care model isn't providing the care that's needed, even with AI and whatnot. You can have information. It can be very well collated and appropriate information, but still I think there's a level of complexity that I think people are going to want, and especially in the face of the chronic illness that we're facing in this country. I think people need something different. I don't doubt that AI is going to be a huge part of that. I mean, people can go look up stuff. It's been a help. They can get actually good answers.
I will say, in my experience, the patients who are the happiest are often the ones with chronic issues that we can't control. because they know, they know how they were feeling, and
Right.
they can see it and they can communicate about it, and you can talk to them and make them understand why these things are affecting and the changes are working.
Right.
But then there's the other side, you talk to someone, you diagnose them, you do everything you can, and statistically you're probably correct, but it still doesn't work. And it's impossible to emotionally satisfy that crowd.
Well,
But the other side of it is that the aspect that I think AI won't touch for a long time is the mental health side. And more and more primary care is doing that. And you can even, St. Cloud, I believe, is still an area of critical need. So as a primary care physician, if you want to do some psych stuff, you can, if you get the ACN license.
well, again, that's a whole nother issue, the chronic medical or mental illness piece. Is that metabolically driven? Maybe not entirely, but I think that's part of it, and I think that ties in with the chronic illness. But that aside, let me give you a scenario. I was chatting with my wife. She had listened to a podcast I sent her about seasonal allergies, and she was exasperated. The speaker on the podcast was saying, well, seasonal allergies, you have this going on in your microbiome, and we can do this and we can address that. And if that doesn't work, then this other thing, and blah, 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 and on down the line. And that's the beauty of functional medicine. We're going to keep digging. And she said, but it seems like, and this was correct, you can just keep peeling back the onion layers. And where does it stop? And sometimes I just want a pill.
Well, that's the number one problem. That's
Right.
metformin right there.
Yeah.
And that frees up if people just exercise and cut down maybe 20-30% of their calories, maybe a little bit more. I think that frees up what I saw the numbers. I'm probably going to misquote them, but something like $400 million just in type 2 diabetes alone.
Oh, easily. Yeah.
All you got to do is get up and stop eating a little bit.
Yeah, the lifestyle factors have been shown, even in the American Diabetic Association. They say lifestyle and nutrition are key, but that is hard to do.
It is.
So anyway, what I'm getting at is we have these varying issues. We have the desire for a quick fix. I want to take a pill. It's very difficult to make lifestyle changes. And as I was pointing out, I said, the problem is that we're so chronically ill that we're beaten down, so to speak, and we don't even realize it. We're like the frog in a pot of warm water. And so it's hard to come back. And I said, but really, ultimately, what you want to do is establish good habits of healthy lifestyle, proper nutrition, avoiding processed food, trying to avoid as much of the toxins and things that are in foods as you can, and get plenty of sleep and regular exercise and what you were saying, and that would really go a long way.
90% of it right there.
Right.
But how do you get people to do that?
Right. Well, I think more and more people are waking up to, I've got a problem. I've got to do something. A lot of people don't see it. I
think a lot of the problem is that even if they do see it, they'll try once and it's hard, and then they just stop, and it's just easier to take the pill.
That does it. I'm just quitting.
That's it. Especially when, as a provider, you tell them all this, and they're going to say, "Didn't work. Give me the pill." And what do you do at that point? I mean, you either lose your patient or you give them the pill.
Yeah.
Because they'll just go next door.
Obviously, I believe, yes, there are a subset of people that are going to behave that way and want that. And that's understandable. Now, of course, maybe I'm biased because I'm entered into this world and see it this way, but that there is a growing number of people who are interested in doing something different, doing it a different way.
I agree.
And the U.S. healthcare system, we're spending 17% of our GDP on healthcare. It's going to break the bank. Mm-hmm. I mean, talk about a looming crisis that no one's recognizing. 17%, $4 trillion on healthcare. And what do we have for it? we have a chronically sick population. If you believe those numbers from the Johns Hopkins, 93% have some problem going on. Then you have the mental health aspect that you touched on. A lot of that is metabolic. Some people suggest that we're overdiagnosing. We're medicalizing emotions, for instance. And then we run for a pill, and we're using SSRIs that don't even work, and in teens can increase the risk of suicide. And you just look at this and you say, what are we doing? And something's going to bring it to a crashing halt, I'm concerned. Then on top of that, you have the burnout issues. You have the docs that you talked about, the system, how the finances have shaped it and led to large corporations taking over the small. You've lost that personal touch, and the physicians are burning out at ever increasing rates because they're being forced into a hamster wheel model of seeing volume, and they're losing that personal touch that they want to bring 100%. To people, and creates frustration. Then you throw in the paperwork and all the other things that they're called upon that aren't reimbursed for them, and the difficulties that they encounter with that. And it just feeds into, you got to go, get the charting done, et cetera, et cetera. So I just think it's unsustainable.
Agreed.
And AI may help, but I think there's going to be more.
I think it's going to hurt the physicians, because then you're only going to need one physician to monitor AI as a medical director more than you need more physicians. You know, it's going to kill demand.
Do you think there's a movement for people to recognize and say, hey, I need to get more healthy. I'm going to have to do this. Or you're not seeing that?
No, I think there is. I think just when you just drive around, especially in not even smaller towns, I was going to say anywhere, there's more people running. There's more people outside, I think, now than I have seen in many, many years. Yeah. So I do think that is happening. But I feel like there's going to be a fairly hard divide. Either you're doing it or you're not. I don't see too much in the middle. Right. Yeah, I see your point. You know, do you think that some of the changes at the FDA and the HHS, you know, changing the food pyramid and this greater emphasis that they're bringing could show some leadership that will help? Because people are going to follow the authority. I think, yes. The downside, because there's a positive, negative, everything. So I definitely think that's a factor, and I think that can be, and it should be, hopefully. The downside is all the crap that's on social media. And that's social media having crap, right? Oh. And so when you combine those things, how do you filter it out? Right. Because you see so many things that just aren't true, that people will, you know, they'll die on that hill, that it is true. And then they put it out there. They have 6 million followers. People are more likely to watch someone like that, I think, than the FDA. A lot of people. There's certain people. And that's the challenge with that. Well, certainly I think the FDA, I mean, you read McCary's book and you see why there's some loss of trust in institutions like the FDA. Right. Do you think this is maybe a settling process that, you know, with MAHA and HHS leadership change and whatnot, they've kind of thrown a wrench into things that has been coming? Because the evidence, for instance, take bioidentical hormone replacement in the WHI study. That was very flawed. The Women's Health Initiative back in 2000 kind of put the kibosh on the use of hormone replacement therapy for women. Okay. Overnight, women stopped using their estrogens because they were terrified they were going to get breast cancer. Right. Okay. So and this is that's a common trend, though. That's with those studies. I didn't mean to step on you there. No. What I was saying is that we were talking about, for instance, the FDA and some of the loss of trust that people are having. And so I was asking, is this maybe a sorting out process? So to touch on the study that you mentioned, and then it just coincides with, the autism study and some of these other ones. It's the same thing. I think one of the biggest factors that inhibits us from taking definitive steps forward is the fact that politics and media are so heavily involved in what should be a very objective process in the studies and the medical side of it. You look at the COVID, all the different things that happened with COVID and how heavily it was influenced by politics rather than science, and how much simpler it could have been.
Right.
I mean,
Right.
You had the two extremes going on. It just, the emotional play on everybody, and including me, like you didn't know in the beginning.
No.
And you're listening to both sides, wondering where the truth is.
Right.
And of course, it ended up being somewhere in the middle.
Right.
But you don't know
But it's
that until
hard to-
after the fact.
And you had to have some very specialized abilities and
Right.
knowledge to sort that out. What do I know about vaccines?
Yeah.
mRNA vaccines were maybe, 20 years old, which
Right.
is good, but that's just the beginning.
Well, even regular medications. If a medication's, even if it's 5 years old, I'm not that comfortable with it. Let alone 10
sure.
years old, even.
Right.
And until it's then the studies they do are 1,000 of people at a time.
Depending what.
Yeah.
Yeah. I mean, they get, I know this is a hot button topic, but vaccines and what my understanding is that the testing on that is very limited, even compared to drugs.
Right.
Well, that gets back to my point about the need for leadership, the positive benefit of leadership, but the
How do you
crisis of
think-
trust that we're having.
With the leadership change, how do you see that kind of snowballing into a major change?
Well, I'm hopeful that it can. I think it's opened up some space for discussion. You listen to Marty Macri and read his book, Blind Spots. He's very much about, we have to look at the science. We have to look at the studies. And so I mentioned the WHI and some of the warnings about hormone replacement therapy have been removed, and especially also about testosterone, the black box warnings have been removed because they went back and looked at the evidence and the studies and said, hey, here's what we have, and this evidence is good, so we can make this conclusion, which I think is what you and I both are saying. And so in answer to your question, I believe that they have brought in some fresh air. They're willing to try and put aside some of the politics and look at the studies, look at the evidence. And I think that's the appropriate approach.
Right.
And so if we can do that, that's going to help reestablish trust and allow for entities like the CDC, the FDA, and whatnot to take leadership and help. And also the trajectory and the direction, I think, is in a more positive direction. So, for instance, the changes in the food pyramid, as I understand it, are certainly away from processed foods and healthier choices and better understanding of appropriate macronutrients and how they should be apportioned for our intake. I think that's a huge thing. Like we were talking about getting to fundamentals, lifestyle, nutrition, exercise. I think that's a step in the right direction. So that's where I think those are.
No, I agree. I think the challenge is when you already have this huge population that's sick and it's chronic and they're being treated and it's already super expensive. Obviously, we would save so much money if we used some of that and spend it on personal trainers and nutritionists, and rather than giving a referral they can't go to because it's not covered and they can't afford it.
Right.
Actually, paying for those things would, in the long run, make it back, probably 100-fold.
Right.
But how do you do that when it's already allocated here, and these people are already sick, and it's already costing this much? So now we have to increase the cost before it goes down. And how do you sell that?
Could that be helped with different regulations? How does that work?
I don't know. I really don't know. I mean, it would have to be.
How about opening things up for a health savings account? I've long been a proponent of something like that, where you take some of your money mandated into a health savings account. You can start when you're young and healthy, have those discretionary funds, not tied to a super huge deductible insurance plan, make it available for everyone. use some regulation to shape that in the same way that we have qualified funds in retirement, for instance, and say, hey, look, this is for healthcare needs. And
I 100% agree with it. I think the problem is when you already have a population, and since he kind of goes hand in hand, let's say this, but the less educated are often the ones that are more ill.
oh, you have to take care of people.
When you have that and you're saying, all right, now you have to allocate more of your money over to something else,
Allocate more money
like a
to
health savings account.
Oh, to the people who are already sick and
Right.
whatnot. Oh, yeah, no, there has to be a way to help. What you're saying is
crutch.
we got to clear the top.
Yeah.
They're already in trouble. They're far down the road,
Right.
and we need to take care of it.
And it already costs that
Sure.
much. And I hate to say it this way, but they're not coming back at this point. There's a large percentage of them that aren't.
Right. Right.
And so giving them a personal trainer and giving them a nutritionist is
Right.
Beating a dead horse, so to speak.
Well,
for a percentage, not all.
Yeah, and I wouldn't be entirely negative, but your point stands that they're quite ill and are
Like if they're
consuming a lot of
already
health.
not listening every time they come to you,
Right.
and you're saying just exercise and don't eat,
Right.
just watch how much, and they can't do that.
Right. Well, this is the situation, and you're exactly right. You got one thread here, you start pulling that,
Yeah.
and it's in here and over there, and it's unraveling here. And so, yes, that has to be, it has to be recognized. We can't use a reductionist approach.
Right.
We can't just say, okay, we're just going to do this one thing.
So
Let's
maybe
fix it.
then it starts with kids.
Oh, absolutely.
So this is an interesting story that I heard, and it's different, but it applies. So I forget which company it was wanted to get coffee into Japan and start selling coffee.
in Japan. Okay.
And they hired these consultants, sales consultants, to say, how do we do this? We want to get our product into Japan.
Okay.
And they said, you can't. It's going to take 15 years, and you got to spend X amount of dollars. And they said, why? Well, what you're going to have to do, because they don't know what it is and they don't care. So what you're going to do is you're going to produce a cartoon. And in this cartoon, they're going to eat these candies or something.
Oh.
And these candies, you're going to start selling these candies, and they're going to be coffee flavored. And then 10, 15 years from now,
stop.
you have a market that wants coffee.
Huh.
So if you take the same approach on healthcare,
Right.
you got kids in class, start young. They should be exercising. They should be eating right. And what are the benefits and things? So 10 years later, you've already got them. And maybe you don't even need these things we're talking about because they're already there.
Well, I think some of that process is in place as people are becoming more aware.
I think it is. I think that's what you mentioned earlier when we are seeing more people exercise, more people out there, and it is making a difference.
Right. And I also think, getting back to the analogy of things, one thread over here pulling on something else over here, we've got, you talk about that marketing. I mean, kids are marketed to.
Yeah.
In the Senate hearing that Casey Means was presenting at, she was talking about, for instance, Fruit Loops. The dyes that are used in our Fruit Loops are different
from Europe's. Yeah.
because they mandate you can't use that chemical. You have to use natural food colorings. That's a simple little thing. But yet so that's a regulatory change that could be made. I'm not advocating Fruit Loops of any stripe.
Sure, right.
But the point is that if we start getting rid of the highly processed, I'll call it dangerous food stuff, food-like substance, that will begin, or that's a great foundational piece to help with the very thing that you're talking about.
Yeah, 100%. The problem on that end is how do we, and I think it started to happen in some respects, but how do we make, what am I trying to say? It's hard for people on a budget to avoid processed foods with the way that things are sold. It's so much easier to go get a $5 pizza that'll feed the whole family than to cook from scratch, So you got time. And how do we convince, and I don't know if it's a matter of convincing, because I have a feeling the margins on the crap food is much better than the good stuff.
Oh, yeah, I imagine so. Yeah, the green
that's the
grocer,
next step.
the margins in grocery stores.
Yeah.
Yeah, and that's why they have a lot of that extraneous things. So, yeah, that is a problem, obstacle to be overcome. But for instance, and I don't want to get too far afield, but restricting some of the purchases that can be made with the food stamps, for instance, will help. I think those have been instituted where people can't buy some of those.
Yeah.
So that's a step
helpful.
in the right direction.
Definitely.
That's scratching at the surface, pulling at that thread. But Tony, we are so used to this lifestyle that sometimes we can't see our way out of it.
For sure.
Our
I'm
grandparents.
guilty. I ate a lot of crap food.
Yeah. But I mean, our grandparents, when they didn't, I'm older than you, so maybe my grandparents and your great grandparents. But the point is, there was a time where we didn't have this. Sliced bread, Wonder Bread, wasn't developed until the 60s.
Right.
And they called it Wonder Bread because that was the best thing since sliced bread.
Right.
That's where it came from. So it's marketing, and it was designed for convenience. But maybe if people are waking up and saying, hey, I've traded my health and longevity for convenience. Is that a trade-off I want? Is that a trade-off I want for my kids? Let me figure out how to change things in my own home. So my kids have gotten into bread baking.
Oh, nice.
Yeah, and so they make their own, sometimes for fun, they make bread and bagels and stuff, and that's healthier than what you're going to buy
Definitely.
off the shelf. So having an understanding and figuring out ways to accomplish a goal, but it has to become a goal and it has to be seen as valuable, to the point that we've been making in our discussion. But I think there's a way forward. I hope there's hope.
I think so.
Yeah.
And here's a question for you then. I think the biggest adversary to any of us, that's going in the right direction, is going to be all the companies that benefit off chronic illness. And how do you fight them when they're the ones making trillions? That's the hardest part. I don't know. I don't even know, because that's just being in the medical business. That's
right. Yeah, I didn't even want to touch that. Yeah. Because you're right. Money talks. Yeah. And people are making huge amounts of money off of selling food-like substances. Yeah. The margins, I imagine, are better, and you're marketing to kids.
It's much more profitable to keep people sick.
Right. Right. And a very cynical view of the pharmaceutical industry is keeping people sick. You just treat the symptoms, and they have to have lifelong insulin instead of getting off of getting healthy when they had the opportunity. Now they're on insulin for the rest of their lives. Yeah. And that's a cynical view, one that sometimes I share.
I think it's very real. I don't think it's a blanket view. Like, it doesn't cover everybody and everything, but it's definitely out there. Right.
And how did it get there? Was it nefarious or anything? I don't know.
I think just natural evolution. You put, the government's, like we talked about, the government's inefficiency and their drive for profits together. That's it's a Frankenstein's
also
monster.
I think it gets to a perspective, a worldview, a viewpoint that if I can get to this solution, take care of the blood sugar problem, and I can make it better with insulin, I've done a good job. So that's not the answer. The answer is not the insulin. It's the insulin resistance and all the metabolic problems that the person's having. Sure. But until you see that, and if your viewpoint is reductionistic, and I'm going to get down to this simple answer to this problem and fix it, I've done a good thing. So I think we have to change our viewpoint.
There's a positive reinforcement on both sides of the table. That the patient feels better, the doctor feels satisfied that their patient is happy.
Yeah. So I'm just trying to inject a little less cynicism, talking to myself as much as anyone. Right. But yeah, I think it's part of the way that we think. We'll land this plane, but I was having a discussion with my son about progress. How much progress do we need? And we have this viewpoint that the next thing is always better. So the next GLP-1 agonist is going to be better, and so on. And we just keep marching down that lane instead of stepping back and saying, hey, this is a lot more complex than just picking off this symptom and finding this drug for this. Right. Take Alzheimer's, for instance. The leading theory is amyloid causes Alzheimer's disease. A competing idea is that it's a reflection of a metabolic disease process, and we have to untangle all those metabolic components. So so my point in that example is there's two different ways of looking at things and how to approach it. We can come up with drugs, which the pharmaceutical industry has been avidly pursuing and throwing lots of money into blocking amyloid. None of those have been shown to be effective, but yet we keep doing that.
Right.
Versus this other thing, which is not accepted. It's out of mainstream and whatnot, but it depends on how you look at the world.
Sure.
That's what I'm getting at. So anyway.
No, and I agree with you. I think the functional side should be the primary approach until it's not working. Mm-hmm, mm-hmm. And then you can go somewhere else. But there's no reason not to try it. It's ridiculous not to try it.
Yeah. Yeah. And I think to that point, you want to start looking at what makes the most sense of all the data. Are things interrelated or are they simple?
Data is the other problem, though. It's so hard to measure things long term with people. Let's give a theoretical study. Say you're going to do a 10-year study on a drug, or even if it's 1 year, and you know these volunteers are going to do it for a small amount of money, and they have to agree maybe during this period not to drink and not to do this. Every time you interview them, did you drink? No.
Right.
You know?
Yeah.
So even the data itself is so hard until it's released, and now 1 million people did it. Now the real study begins.
Right. And that is a real problem, especially when you want to bring in nuance and complexity. It's so much easier to design a randomized controlled trial where you're looking at one variable.
Right.
So that again gets to the perspective how you think the world should be and how it runs. If you're willing to say, I'm going to do a randomized controlled trial, I'm going to put the money in, and I'm going to look at this one variable. Yeah. But if you say, I understand that this is just one piece of the puzzle, I'm willing to live with that piece and address the questions that come from it and recognize that it's part of a whole more complex picture. But so designing those trials is difficult.
Typically, the data isn't meant to be used the way the media and politics will pick it up and run with it. And that's where the biggest problem is. Right. Because you can say, hey, our study said this. They'll probably even in that same conversation say, we know it doesn't really mean much, and we're going to keep looking. Too late.
But it's the headline, it's a soundbite, it's out there. Yeah, and you see that, for instance, with associations in studies rather than a randomized control trial. Yeah. Such and such is associated with this, and oh my gosh, and then they run with it.
What does that even mean?
Right. And social media, and it takes off. So, there's a lot of issues, a lot of things that need to change in order to make a difference. I think we have to. I think it, in some ways, is going to be forced upon us. I just hope we don't keep tinkering around the edges on an edifice that's already shaky and falling down.
Agreed.
Because I think we're going to be in trouble. We are in trouble.
We already are. Yes, for sure.
Thank you. We are 100%. In trouble.
If we weren't in trouble, I would still be.
We have the sickest population of all developed countries. Yeah. That maybe I've overstated that a little bit. I don't know the exact numbers, but the point
regardless, stands. Even if they're all sick too, doesn't make it better.
Right. Exactly.
No, I agree 100%.
Well, it's been a great conversation.
Yeah, absolutely.
Yeah. How fun.
Yeah.
Can we quit now? I don't know how to end it.